PSA is actually a blood test, and it looks for prostate-specific antigen is what PSA stands for. That is a glycoprotein. It's a chemical. It's found in blood, and we find that PSA is elevated in men who have inflammation of the prostate. We call it prostatitis. It's also elevated in men who have prostate cancer, and an elevated PSA helps us to determine that we need to biopsy a man's prostate to determine if he does have prostate cancer. PSA testing is a mixed bag. It clearly finds additional prostate cancer. We've got some studies to show that it misses as much prostate cancer as it actually finds. It finds a lot of prostate cancer that is disease that would never kill someone. So it doesn't help us to figure out those men who need to be treated versus need to be treated. I can tell you about 1 in 4 men who has an elevated PSA is going to actually have prostate cancer. I can tell you the higher the PSA, the more likely that man is to have prostate cancer. So it is not very specific. First, I should point out that no organization that I am aware of that has looked at the data and sat down and gone through a process of analyzing the data simply says men should be screened for prostate cancer. The American Cancer Society has looked at the data, and we recommend that men be offered screening, be informed of the uncertainties, be informed of the potential risks and the potential benefits. And those men sitting down with their doctors, talking about their concerns about prostate cancer, talking about their overall health, make a decision as to whether or not they should be screened. If men decide that they want to be screened, most men should start at the age of 50 and get screened every year. Men who are from a family at high risk because of being of African American heritage or family history of prostate cancer might make the decision to start screening at an earlier age. The American Urological Association, the urologists or the doctors who treat prostate cancer, they've looked at the same data and they've made the recommendation for informed decision making starting at the age of 55 rather than at the age of 50. And they also say that people who are at high risk or people who are very concerned about prostate cancer might start earlier. The U.S. Preventive Services Task Force, they have looked at the same data and they recommend against prostate cancer screening. They have noted that the benefits are not substantially greater than the harms. Amongst all the organizations, and there are about 9 or 10 additional organizations in the United States and Europe, everybody is falling into this informed decision-making at some point, although some organizations like the U.S. Preventive Services Task Force, the Canadian Task Force on the Periodic Health Examination, they actually come down a little harsher and say, don't screen. I should also point out the American College of Physicians recommend that men not get screened for prostate cancer.